Okay, we are going to talk about a new technique in facial skin resurfacing called portrait plasma regeneration. So what is plasma? Essentially, plasma is ionized gas. So it's a nitrogen gas, which is a inert gas that gets excited by ultra-high frequency. And that ultra-high frequency bombards the skin in a non-contact way in order to regenerate the skin. Now that won't be entirely clear until we progress, but that's the basic modality, the way that it's used. What I would like to do before we continue with this is sort of give you a perspective of where I see plasma resurfacing is. 13, 14 years ago, we had the carbon dioxide laser that came out, very aggressive, led to progressive loss of skin color or hypopigmentation, prolonged recovery times, redness that lasted a long time, literally burned off the skin. Most people can't tolerate that, and it's also unsafe for people of color. When I started my practice, after a lot of training with the CO2, I moved to the chemical peel. But the peel only provides more of a superficial treatment unless you're doing something aggressive like phenol, which obviously has its problems too. So how does this work? As I said, it's a non-contact device. It's not touching the skin. And that nitrogen gas makes contact with the skin to create the energy changes that are necessary in order to rejuvenate the skin. So I really see plasma as providing closer to what CO2 does, with a recovery very similar to a, say, 35% trichloroacetic acid or TCA peel. The other great thing about this plasma device is that it's a non-chromophore dependent procedure. You don't have to worry about a certain color in the skin. All lasers are chromophore dependent by their very nature. And this is not a laser. This is not even a light device. It's a plasma device. So it's non-chromophore dependent. And there's a full range of joule settings that we use, low settings and high settings, depending on the recovery and the skin color and the desired changes that you want. And we're going to go through each of those settings in a moment. So how does this work? This slide helps you understand basically how plasma works. There are two zones. One is a zone of thermal damage. That is like CO2 or the peel, where it's taking all that outer dead layer of skin away, and that you see an immediate improvement in. The zone of thermal modification is the area where the heat of the nitrogen gas affects a collagen remodeling that, in my opinion, takes about 4 to 6 months to see that change, and it's progressive, so that up to a year you're still seeing positive changes in the skin. That is what I think you're missing in some of the more superficial or medium depth chemical peels. So what happens here? What is so special about plasma? Well, a few things. Just like a chemical peel, the outer skin stays intact. You don't burn it off. It stays intact at the high settings. At the low settings, it never comes off. But at the high settings, it stays intact for about 3 to 4 days. The reason that's so great is that you don't have the burning discomfort that you do with CO2 laser, because the skin is still intact. It also expedites the healing. So within a 7-day period, your new skin is formed and you're already pretty close to being healed, maybe a light pinkness that's there. So that's what's important about this wound response without a wound. You don't have an open wound, maybe only for a couple days, and there's really no discomfort compared to like CO2. So this is the device right here, a picture of the device, and you can see on the right side the plasma gas coming forward, and that's the handpiece in full view on the bottom right. And there's a nitrogen gas cylinder on the back that works with this that needs to be replaced, along with handpieces that you need to change out. So here's some histological slides to show you what's going on. There's a vacuolation of, or emptying, if you will, of the basal epidermal cells. And that vacuolation is very important, and I'm going to talk about how that's important at the high settings in a few slides from now. So you can see here that even at that line of cleavage, that there is the old skin still intact. And the lower skin with the new stratum corneum is already beginning to form below it. So what's great about that is you have that biologic dressing that stays intact for a few days at the high setting. And now you can see full regeneration at day 10 all the way up through the epidermis with the higher setting of PSR3 here. We'll talk about those settings in a moment. So you can see at day 10 there's a lot of histologic changes at the dermal layer. So what settings are available? Okay, this is meant to make it easy for you. The best way for you to think about it, there's a high and a low setting. I would say in Fitzpatrick 4's Hispanic, darker skinned patients, unless you're dealing with Mediterranean or Caucasian or lighter skinned Caucasian patients, I would recommend that you go with the lower setting. That's a PSR1. That is an incremental setting around 1.3, 1.5 joules that you perform in the office, really with no sedation. A little topical anesthesia is all you need, and the patient feels very good. And the skin doesn't fall away. It just becomes stripy for a few days. And that will last a recovery about 3 to 4 days, and you need to do that about 3 times. At the high settings, PSR2 and PSR3, you're basically around 3 to 4 joules. And that provides the old skin falling away and true deeper rejuvenation. And I'll show you some of those results in a moment. The difference between a PSR2 and a PSR3, which I will explain more in detail in a moment, is whether you do a single pass, and the PSR3 involves going back a second pass to those deep wrinkles and deep rhytids. That's essentially the difference. If you ask, well, what happened to the 2 joules and the 2.5, what happened to all that? They've shown that at the medium settings, you get the recovery of a 3 to 4 joule setting with none of the benefits. So you either go high or you go low. You really shouldn't go between the two. So here's this Express. This is very new to me. The Express is extremely low settings where there's really no recovery. But this is brand new, and I don't have any experience with it, so I don't want to get into what Express is. But it's basically below a joule. And the idea is that you go through multiple treatments, but you have literally no recovery. But with the PSR1, the low setting, you go through a little bit of recovery of 3 to 4 days where the old skin always stays intact, just becomes a little stripy and a little bit darker for a few days. And remember, the PSR2 is the high setting with a single pass. And you can see the results are not equal to CO2. But with all the negatives of CO2, I think there's a safety level with the plasma that affords you a great rejuvenation, maybe not to the level of CO2, but without the risks and downtime associated with CO2. Okay, let's talk about PSR3. That is at very high settings, that 3.54 joules, with that added pass, where that if you got those deep perioral regards and wrinkles, you'll go back and treat it one more time. That's PSR3. It's basically PSR2 with an added pass over the wrinkles or over the whole face. Now, I think that's a little aggressive. I usually do a hybrid PSR2-3, in which I do a single pass high setting for the face, and I'll come back selectively and add another pass over the deeper wrinkles. This is that vacuolation I talked about earlier, why it's so important. The cells literally become debris in that area where the first pass goes. But because there's a Gaussian distribution of energy, there's areas that are missed, so to speak. Now, even if you miss it, the collagen is still remodeling. But if you want maximal changes there, you can double pass again, and the areas where you passed before are safe because they're protected with evacuation. You can't go hit that again. And that's what you're seeing here. I hope that's not too confusing. If it is, you can ask me afterwards. At the low settings, there is no evacuation at PSR1. Meaning, do not double pass at low settings. You can cause a problem. In fact, what I usually recommend as you're doing this treatment is not to snake back and forth, but go row after row after row, finish a subunit, of the face, and then come back and do your PSR3 double pass settings. So here's that added PSR3, where I think the makers of this product are pretty honest. They're not equal to CO2, but they're very good at PSR3 settings. So remember one thing. There's a combination of zone of thermal damage, which is taking out that old layer of skin, the dead skin, the old sun-damaged skin, which you see benefits immediately, and the zone of thermal modification, which takes months to begin to see those changes. And the second point to repeat is the fact that the old skin stays intact for several days. That's important as a biologic dressing. These are just some histologic changes, and the point of this slide is not for you to memorize every little histologic architecture, but to understand that the evolution of improvement requires a full year. And during your pre-consultation with a patient, you must convey that information effectively. They will otherwise come back to you at a month and go, how come I wasted my money? You have to educate them that at a high setting, or even a low setting, that collagen remodeling takes a long time. Especially at a low setting, because at a low setting, at PSR1, you don't get that outer layer skin change immediately like you do with a high setting. You're waiting for that modification, that deeper collagen to occur. That takes months. So handhold the patient through that period of time that you have to wait for those changes. So really, it's FDA cleared in the United States for wrinkles, for precancerous lesions, the actinic keratoses, and it really helps reduce wrinkles, improve skin texture, tone. The acne treatments, I've really only done one lady, and it's still too early for me to say if it works. But reportedly, other clinicians have found efficacy and benefit treating acne scars. And remember, just to repeat, that it's a non-chromophore dependent procedure. This is not a laser. It is not a light device. It is a unique modality, a unique treatment method. Sorry for all these words in English. I know that this is not your native language, but this is a lot of information. Anything particularly here? Not really anything here that I would want to address. I think the bottom half of the screen we can talk about. What do you need to know to help take care of a patient? At a low setting, all you need is a hydrating cream on them for about 45 minutes to an hour. There really is almost no discomfort. If you're going to do a high setting, I really, really advocate having the patient under some form of sedation, because just topical anesthetic and even a regional block, great dental block, and extended zygomaticofacial supraorbital blocks, it's still uncomfortable. They need something more. So if you're going to do this, some kind of IV sedation, IM sedation, added PO sedation, something extra to make the patient feel comfortable. That's important. They do feel like a sunburn for the first 3 to 4 hours following the procedure. What I like to do is put back the hydrating cream on for another few hours to help them through that. It's not painful, but it does feel like an intense sunburn that goes away in a few hours and does not come back. These settings here are just to repeat one more time, because there's a lot of information I'm covering. I'm just trying to go through it one more time. Again, the Express is very low energies with no recovery. The PSR1 is a low energy setting that requires multiple treatments, is done as an in-office procedure. And the PSR2, PSR3s are high energy settings. One's a single pass and one's a double pass. And that does have the old skin fall away over a period of that week, and it comes back. That is a real recovery involved. These are some examples of a patient that undergoes a high energy setting, and you can see at 4 joules with a double pass, a PSR3, the old skin turning brown and then sloughing away. And you can see that within about a 7-day period, there's a regeneration of skin. I would say that in an older patient, if you're doing PSR3, double passes, in my experience, you could push that recovery toward day 10. This slide from the company shows improvement over a period of 1 month. I think this is a little bit too early for, in my opinion, to see some of the deeper wrinkle changes. I'm going to show you some of my results as well. This is a PSR3 setting, and you can see that there is pretty quick recovery period over that 7-day period. Although, again, I would tell you that it may be a little bit longer than that. One more thing is important when you're treating the patient is be careful keeping all the old stratum corneum intact. You don't want to scrub it away. That is a protective layer during treatment. So no facial scrubs for a week before, and when they come in, no facial scrubs at all, and just gently clean it off. You also want them not to have any kind of acetone or alcohol. This is flammable. So oxygen is turned off for the time of the treatment, and that's very, very important as well. These are some changes. You can see the periorbital improvements in the rhytids and the wrinkles there at the high setting, and this is a regional treatment of PSR3. Regional meaning that they only treated one part of the face. I have never done that, except a touch-up on a person that had it done somewhere else. But otherwise, I generally speaking don't do that. The company argues that even in a sun-damaged skin, you're not going to see a line of demarcation. I don't know. I mean, I don't have any experience. I just usually treat the whole face. Another example of a PSR3 high setting with you can see that improvement takes months to start showing the changes. And again, you can see the changes in the superficial dyschromias as well as the superficial rhytids, and the texture and tone of the skin has improved over 3 months. Close-up photographs, some of the brown is improved and the texture tone is improved. And that's a realistic example of the rhytids near the eye are not entirely gone. It's the deeper wrinkles oftentimes don't necessarily completely go away with this. They do get improvement though, and I'm going to show you some of my results in a moment. And again, you can see in a close-up macro photography the improvement in the skin architecture. Another example here. Another example. Another lady that I did upper blephs, fat grafting, and plasma, and this is about 3 months out, and there's still a few rhytids around the mouth. That does take a while for it to soften as time goes by, but there's a nice improvement in the texture tone of the skin, and this is a realistic example of the improvements you can achieve. Just to express my bias again, I tend to be much more combining fat grafting and plasma as one treatment because I like the results of doing both. Although in your hands you may be focused more on just doing plasma. This is about 4 months out. You can still see some of the rhytids around the mouth, but otherwise a nice improvement in the texture tone of the skin and improvement overall. So in summary, this is a brand new technology. It is not a laser, it is not a light device. And you can choose between high and low settings, although if you're dealing with the Fitzpatrick 4 and beyond, which probably is mainly here in Bogota, you probably are dealing primarily with doing the lower PSR1 settings. And there is a nice change for the aging face improvement with, I would say, the safety and recovery of a peel with a result that approximates but does not equal CO2. It's an easy procedure to do, but you have to have good hand control doing it because you don't want to burn the patient. You have to keep a non-contact distance during the whole delivery. There's also, just to reiterate, I didn't stress this, is there's no eyewear. Since this is non-chromophore dependent, it's a safe procedure. It's just basically nitrogen gas. And it can be used in the neck, chest, and hands, but at low settings. And that may be something that you may be interested in combining with your rejuvenation. I like to do it in combination with other procedures. I tend not to do it in isolation as much. That's how I run my practice. And that's it. I guess we're on time? Great.